I'm a consultant psychiatrist. I work in the specialist eating disorder service at Southmead Hospital. I look after people who've got eating disorders, mostly very severe eating disorders. Some are very ill and need sort of urgent medical care and then quite long hospital admissions on a refeeding program. And some are less severely unwell and they essentially are treated with psychotherapy. And there's a lot of sort of treatments in between. I have various fixed events in the week which happen every week. So my ward round, for instance, where I review my 10 inpatients. I have quite a lot of trainee psychiatrists. Each of those gets an hour a week. Psychiatry is very good at doing supervision. We take that very seriously. I go to meetings, I see patients. I have a few therapy patients all the time. Quite a lot of the time is also reacting to GP phone calls or phone calls from family members or patients, or I'm seeing a patient urgently. So a mixture of fixed and sort of flexible activities in the week. Eating disorder psychiatry brings back some physical medicine. Some of the patients are critically ill, and indeed we need the help of physicians and medical wards to care for their physical state. But it's a mixture of physical, psychotherapeutic and psychiatric treatments, which suits me really well. The NHS is fantastic, but it's a burdensome place to work too in some respects. It's very bureaucratic and the bureaucracy changes quite rapidly, and we're always being set new sort of targets to chase, often sort of from very distant politicians who don't seem to quite understand the grassroots work. Most of psychiatry is not taking place with inpatients anymore. I mean, there's a fraction of the number of inpatient beds now than there were 20, 30 years ago. So often you're going to be spending your times in a community mental health base. You need to have quite strong support networks and professional sort of networks in order to keep close to your colleagues. And I think I sometimes envy my general hospital colleagues or my GP colleagues who sit in the same building with each other day in, day out, and maybe, but maybe I'm quite glad not to do that too. I worked in Malawi and did psychiatry in sub-Saharan Africa for a couple of years because my wife was doing anthropology there. So I had a very interesting and informative gap in my training. I'd seen another way of sort of how mental health problems develop in a cultural context. If you're coming into medicine because you're fascinated by people and you want to inquire into what makes them tick, psychiatry is the job for you. I don't think there's any area of medicine which gets you so much into issues of ethics, of philosophy, of spiritual belief, of one's sense of identity as to who one is. And we have to, our patients are coming with problems in all those domains or experiences in all those domains, and we have to address them and inquire about them and try to be helpful.